So, as I was kind of prepping for this interview and I looked at your background, wonderful background, highly, technical and skilled, from Stanford. Then you did a couple things out of undergrad and your master's program, but eventually you decided to found your company. And I'm curious how you came about honing in on the exact idea or problem that you
Yep.
wanted to solve.
It's a great question. I don't think I honed in on the idea. I think the idea and the problem honed in on me. Um, and I feel really fortunate for that. I feel fortunate the problem that I encountered that afflicted me wasn't like an obscure, tiny problem, but was a problem that was a generational problem, a problem worthy of the company and the efforts of the people who are working here at Headway. And um, the problem that we're encountering is building a new mental health care system that everybody can access, because right now most of the people with a treatable mental health condition like a depression or anxiety or PTSD don't access it. And this was not a problem I went and looked for. This was a problem that came and found me. And you sort of mentioned a little bit of my education to early work history arc. Um, and indeed, actually, was at the in school where the mental health and mental health issues found me. You mentioned some technical background, some other pieces of background. The Stanford education, the thing that most prepared me for doing what I'm doing is, I think, being a patient first and foremost. I'm somebody whose life was changed when I saw a therapist. I saw someone that really helped with depression I was going through at the time, and there was a time I didn't think I'd make it to 30. And I really, feel like my life was saved because of mental health care, because of a therapist. And man, I feel so much gratefulness for that. Then when I moved to New York City, as part of settling down, I wanted to find another therapist again. And I failed. I couldn't find anybody whom I felt like I could afford, which at the time meant accepted my insurance. And if I could have used my insurance, right, co-pays are $30, $40, $50 rather than an out-of-pocket fee, which is inaccessible to many folks. And it turns out this problem wasn't a unique problem, even the problem in the space, certainly at the time, that 1 in 4 Americans have a treatable mental health condition. Most don't get care. The number one reason is price. And meanwhile, most behavioral health clinicians, therapists, psychiatrists, they don't accept insurance. They weren't participating in the broader healthcare ecosystem, therefore. And so we have built out a network of behavioral health clinicians, therapists, psychiatrists that do accept insurance because we make it really easy for them. They see patients, they get paid, and we strive to be the easiest and most profitable way for a behavioral health clinician to accept insurance. And we do so being both easy and profitable by using technology so that they see patients, they get paid. We handle with technology all the things that could make accepting insurance administratively burdensome. There's, I wish I had them offhand, but there's wild ratios of how many administrators are manually helping clinicians in the medical world. Hospital systems are dominated not by clinicians, but their staff are dominated by administrators and back office folks. The individual therapists who don't exist in these big systems don't have the ability to pay for those professional billers and take on all that work. And so we've come and built a solution that makes it really easy for them. And thus, we have a network of therapists that do accept insurance. And not only do they accept insurance, and now I get to talk about how we have facilitated and we facilitate tens of millions of mental health care appointments every year that otherwise wouldn't happen if it weren't for what we're doing to help make accepting insurance easy and thus make it accessible to patients and providers. We also have earned the right to do something even bigger, which is all of our clinicians are on a single tech platform. So we can think about a better, smarter mental health care world, not just one that is opening up the accessibility that we have today. And so, man, I feel so lucky. And like I mentioned, this problem found me because if I went and looked and said, oh, what spaces do I want to work in? Legitimately, the last one would have been healthcare.
Mm-hmm.
And in my mind, healthcare was the world of, and the problems that were solvable by people who really understood the medicine and the science. But then I encountered a world actually that had a lot of incentive and structural issues that a willing tech entrepreneur that's willing to wade through what does this acronym mean is what does that acronym mean can help figure out. So ultimately, it's a little bit about how I didn't search for the problem found me.
What's been the biggest challenge so far in scaling the business? I mean, you've done an amazing job in building the business, but what has been, I guess, the toughest part to really building this company?
There's an adage that every time your business doubles, you're a new business. So if you double your organization size, you're mostly new employees. If you double your user size, it's mostly new users. If you double your revenue, it's mostly new dollars. Double your product lines of code, it's mostly a new product. From nothing to billions of dollars of annualized gross revenue. I don't have the logarithmic math in my head right now, but we've doubled whatever, like 30 times, 15 times. And so effectively, I am not coming here as the CEO and founder of one company. I'm coming here as the CEO and founder of 15 to 30 different companies, because every time we double, it's a new company. And I've had to have, like, it's truly been a very different journey for every single one. So like the first answer I give you is everything is I've had to be 30 different CEOs and founders. I'm like, sure, yeah, a CEO's job is different every day, but truly, like, if you look at any interval of doubling of the business, I have to be a new person. And the enormity of that is very hard. So the less of a cop-out answer I give you is like the most important journey that I have been on. Again, I'm somebody who had never managed anybody, let alone manage an organization of nearly 1,000 employees. And I had like a year of prior work experience. I had to really learn. And ultimately, the most important thing I had to learn to manage or lead wasn't the organization, but was at some point it became myself. Mm-hmm. So I'm very much a believer that like you can read high output management and no rules, and the score takes care of itself, and see a template for what a one-on-one looks like and a staff meeting looks like, and read from Claire Hughes Johnson, that tactical, vital but important, vital materials there. You can read the how-to and learn, hey, you can kind of like genuinely be a pretty good manager. And then you got to learn this thing and that. And at some point, like, your ability to learn is capped by somehow fundamentally who you are. You've got strengths, then you learn the tactical things, and then you need to get better and better and better, because your organization, if it's like Headway, is one of the fastest growing organizations at our scale in the United States, has been one of the fastest growing to date. It grows so fast, it pushes you, and it'll push you to a place where you will fail. And you'll fail beyond a boundary where you can just learn something or tactically understand how to do something. It will challenge some fundamental aspect of who you are. And then you will have to learn to manage yourself. You'll have to learn to manage, wait, I'm not learning this, not because I don't understand it, because there's some part of me that's holding myself back. And you have to learn what you need and what your person needs. And man, it's a very challenging thing to do.
And your drive really to make Headway into a big, successful company, where does that come from? Like, you're having impact as is.
I think it comes from two different places. And I think it comes from both love and from fear. The fear is the thing that, the fear is that when I close my eyes, when I think about the thing that has brought me throughout my life, the biggest sense of shame, the thing that I want to cover up, the thing that I feel most, it's that I'm not enough. And so one of the reasons I push and push and push, you can read my 360, I'll send it to you later if you want. Andrew pushes with high standards. And then there's a part of that is driven by some fear that I'm not enough. So I want to push and push and push. And part of that has been pretty productive, right? You drive high standards. Ultimately, like, fear alone will burn you out, and you need to also draw from love. And so there's parts of me that love something that's beautiful and high standards, but there's also the love that comes from outward. And like the fear is something that's very inward, that I am not enough. The love has always come from the moments of looking a therapist in the eye and hearing their pathos, hearing the, like, I'm trying to do this, but I am one person. I am one person drowning in a system that wasn't built for me, that wasn't built for an individual clinician, and then knowing that I could help them. Seeing this person that looks like or feels like or talks like the therapist that saved my life, or speaking with an employee who I've been with for years, who I see in a glimmer of their eye the intensity that feels like kin with my own, or seeing somebody I know transform themselves over a period of time. The love I feel for my fellow employees that I work with every day, the love that I feel for the therapists I work with, the love that I feel for the insurance companies who find themselves in this impossible decision to decide who gets how much healthcare and knowing the burdens that they feel. That love is a powerful piece of motivation. So ultimately, like fear and love, I think, are the two fundamental atomic units of where I draw inspiration. And ultimately, like I'm trying to shift more and more to love rather than fear. Fear is like a dirty, it's like a dirty fuel that has these emissions. Love is a much more clean resource and has a renewability to it. So I'm much more oriented and motivated by love. But man, I'll always have some of that insecurity, and I greet it with love when it emerges. But I'm going to use it to my advantage and to build something that is going to change the world. And right now, I feel privileged that we live in a world of billions of people. I feel privileged to order of magnitude have affected the lives of millions, but I see an opportunity for tens and hundreds of millions thereafter. And I see a world where everybody gets the mental health care they deserve. And I see ourselves as an ability to really enable that for the whole for this country. So I'm excited to make that happen.